Hi, I'm Sean Crowley. I am a registrar working with the Cork and Kerry mental health services. So a registrar is one of the types of junior doctors, and I suppose to explain what the role is a little bit, there's two types of doctors in a mental health team. There's the consultant, who will generally lead the team, and there's other doctors who have kind of different names. So they can be called junior doctors or NCHDs or non-consultant hospital doctors or doctors in training. They all essentially mean the same thing. And basically it just means that we're a medical member of the team. We make decisions about medication and I suppose other things that could help our patients, but we always do so under the supervision of our consultant. The first person most patients meet when they come to mental health services is going to be someone who's a junior doctor. So most new assessments in clinic, or if someone comes in an emergency to the emergency department, the first person you'll meet will be the junior doctor, and the first time you meet them, they'll probably spend an hour plus, an hour to an hour and a half with you to try to get a sense of everything that's kind of going on. Other sessions in clinic mightn't be that long, but certainly the first time people will want to spend a bit of time with you to understand where you're at. After they meet you and do their assessment, they'll generally talk to the consultant about it, and together we'll all make a plan as to how the service can help you most. Another thing to remember is that we're just one member of a big team. So other members of the team would be like social work, occupational therapy, psychiatry. There's a whole team of people who are trying to help you, and I suppose the role of the doctor usually isn't necessarily someone who's going to be doing all of the talking therapy with you. That happens sometimes, but it's kind of the exception. Usually we kind of direct, the care by saying, figuring out with the patient what is the problem here or what is the challenge and how are we going to manage it. That can be medication, that can be other things, and hopefully together we'll kind of make a plan as to where we go from here. Something that's really important to remember is that, however we're going to help you, there'll probably be parts of it that the mental health services can do, but ultimately it's to get you to a place where you can do certain things to help yourself. That's kind of the journey through recovery, from when someone can't really do that to when they can, and that's something that I really like seeing. The first time you see them, you'll probably see them for about an hour or an hour and a half, but usually at a routine clinic, you'll probably only see them for 15 to 30 minutes because we won't be doing the key work with you. It's more directing your care. And something else to remember is that junior doctors, because they're in training, they move jobs every 6 months. So even though you'll have the same consultant ongoing, your junior doctor will change every 6 months. So one of the questions people probably most commonly have when they first come to services, often obviously in crisis of one kind or another or facing immense challenges, is this going to get better? And it's probably one of the most fundamental questions you can really ask your doctor. And I suppose the overarching answer would be yes, certainly. No matter how low you are or what's caused you to get there, whether it's social problems or whether it's something else, like something that can be fixed with medication, one way or another, like no matter how low you are, there is going to be ways in which we can help you and which you will be able to be helped, and most people when they first come in, they tend to, if not get back exactly to where they were before, get a lot better than where they are at that moment. So I think it's important that, for any patient coming into mental health services to know that there is hope there and that you can be helped. So I knew I wanted to be a psychiatrist from when I was very young, which is probably a very, very unusual thing to happen. So I wanted to do psychiatry since I was kind of in my early teens. And I suppose the main reasons were just that I loved listening to people, I loved to get to understand people, and I kind of went into medical school, and when I discovered, I thought psychiatry was the best profession to kind of be with people sincerely and listen to them and understand them, and it allows you to have compassion in your job every day and to kind of see how your understanding of them can help them in a kind of a real and sincere way. So that's why I got into psychiatry. So I think a really important thing to remember is, it sounds really basic to say, but if you do need help, that help is available to you and you can seek help for whatever it is that's troubling you. And I suppose if you are referred to mental health services, that just to know that there's a full team of people who are there to help you, and not to be afraid to come look for that help.